Good morning. So I'm here doing an auto scenario. So I just got called in one of the patient's rooms that there was a patient that's actually patient right now is on room air. So I've noticed the patient, and then before I go inside to the patient, I also checked immediately the patient's chart, and then I communicated with the nurse, and then I realized that the patient was having a carbon monoxide poisoning. And then I also noticed that even though the patient was on carbon monoxide poisoning, the physician did not even recommend on putting up the oxygen device. So I immediately put up with a non-rebreather mask, and then first things first is I always make sure to reassess the patient, obtain vital signs, and then also have to make sure that I check the patient's ID band to know the exact correct patient, and also always wash my hands. So first things first is make sure that the tubing's no kink, and then with the bag should be inflated before hooking up to the patient. So assuming it's being already fully inflated, we should feel it with our hands if there's air coming out. I immediately put up to the patient who was having carbon monoxide poisoning, and then reassess the patient, observe them, and then do another set of vital signs. And then after a few days, such as about 2 or 3 days already, when I was about to do my rounds to this patient, I also noticed that the SpO2 level of the patient was about not going down at least 96% SpO2 level. So it was being consistent at about 100%. So the patient's being put up on this for about 2 or 3 days already. So I just tried to observe also with the ABG, and then the ABG level was going downwards with the CO2, and then the patient's kind of being semi-conscious. So I tried to immediately communicate with the physician and the nurse that I think we need to wean this to the patient. So I just tried to recommend this to hook it up with a nasal cannula, maybe about put up first about maybe about 4 or 5 liters. So turn this one on, off, and then hook up with a nasal cannula. And then make sure we feel it with our fingers if there's air coming out, and then carefully put it to the patient's nose. And then I recommended that the patient should be put up at about 4 liters because we're trying to wean it from non-rebreathing or a higher flow, not to suddenly wean to the lowest level to the patient. And then what we're going to do is that even at 4 liters, we have to reassess also the patient after about a few minutes or a day. And then if the patient's O2 level was able to tolerate after being weaned off with this, we can try to decrease it lower by lower, about maybe about 3 liters, and then the next day we can do it about 2 liters until such time the patient's being removed or weaned from oxygen. And then with these devices, even though the patient's no longer using this one, make sure we always have to put it on the safety bag, and then should be on the patient's bedside, just in case if the patient's condition deteriorates, so at least they already have the device in bedside. So once I'm done, I always make sure to obtain vital signs, do my post-assessment, and then check the SpO2 level, and then communicate with the nurse. But before that, we always have to wash our hands and then document everything and chart them.